The Dr. Fab Show, in association with Artas Hair.
Hi, I'm Stephen Hattyside and welcome to the Dr. Fab Show. Coming up on today's show, innovative cosmetic treatments to give you that extra boost. Lizzie Cundy reveals her red carpet beauty secrets, and noodles with no carbs? Surely not. Now let's meet our Fab health experts for today. Dr. Tracy Mountford from the Cosmetic Skin Clinic, inspirational speaker and coach Craig Goldblatt, and Mail Online editor Deborah Arthurs. Vitamin drips are making headlines at the moment. However, there's a lot of controversy surrounding them. So, Tracy, if we start with you, from your clinical viewpoint, do vitamin drips really work?
So I'm afraid I am a skeptic. I think that pure hydration level of putting an IV into you will make you feel better anyway. Most of us are not well hydrated and should be. I would be more of the feeling that just, again, a good lifestyle, good nutrition, all of that will make those kind of things unnecessary. And until there's evidence to support that they work, I'm going to sit fairly and squarely on the side of I'm really not sold on that.
Okay, well, Deborah, I'm going to shoot up to you. I've seen stories in the Mail Online about these drips helping the immune system, helping with hangovers, jet lag. What's your viewpoint on this? I've seen positive and negative. What's your
Yeah, I would say that anecdotally, people I know who've had them and celebrities say that they do have beneficial effects. They feel energized after them, but without the solid science to back it up, I find it very difficult to say to someone, go and get one, when they could cost £500 a time, and over the course of a year, that can really add up. I would say, show me the science and then I can recommend it as a treatment.
Yeah, great. Now, Craig, on the Dr. Fab Show, it's all about feeling fabulous inside as much as it is outside. So, do you think people need these types of drips to get that extra boost of energy?
My absolute experience tells me that any unnatural high is followed by an unnatural low. If we can take some great walks in nature and be with ourselves, then that's got huge long-term benefits. But anything that is in any way unnatural as a high, what's followed is an unnatural low.
Okay. Just moving on to our next topic, which is dermal fillers. And I'll start with you, Tracy, because I know you do a lot of these types of treatments. But how young is too young?
That's a really difficult question. There's the ethics and the morality of treating people that are too young, and I can only give you my opinion on that. I think that I often turn very young people away from treatment. I think it's getting them onto a bandwagon. They simply cannot get off. I take everybody individually on that one.
So Deborah, in terms of your readers, do you see some of the stories coming out that people are having treatments too early?
I would say our readers, more and more readers in their 20s are asking us, can I have fillers at this age? And having interviewed many doctors, they would say more 35 onwards. I would suggest even later than that, because as Tracy said, once you've started, it's very hard to go back. You haven't really got to the point where where you understand yourself.
Yeah, Craig, I'm sure you've got a strong point on this.
My view is I've changed enormously. I'm changing every year in my life and I'm learning so much. And so for me, I wouldn't do anything permanent, that's going to impact me, unless I've really thought it through. And everybody has different levels of maturity. We meet incredible, these days with the internet and media stimulation, an 8-year-old, 10-year-old, I certainly can't compete with my kids with what they know right now, nowhere near.
Yeah, Tracy, did you want to finish off
I was just listening to what you said there. The only thing I pick up on that is that these treatments aren't permanent, not
Sure.
that are done by professional, ethical people in the UK. I can only comment on the UK market. I think that if I wanted to counter-argue that, I'd say some of these young people can end up sourcing treatments that aren't safe Because if people in the UK refuse them treatment, they sometimes go and source an unsafe treatment abroad. Rather than saying, go away, don't be so stupid, I'm not interested in you, we have to have a balanced discussion with them about why we're recommending perhaps not at the moment, because we can open another can of worms if we're not careful.
Sure, that sounds like good advice.
So thank you very much. It was a really balanced view on some quite controversial topics, so thank you. I'm here with Dr. Tapan Patel, and we're here with Charlotte. Now, what treatment will you be doing today?
So Steve, today I'm going to be talking to you about the Infini treatment by Lutronic. This is a needle-based radiofrequency device, and I actually think this is one of the most exciting treatments on offer in the field of aesthetics today.
So what's exciting about it? What can this beautiful machine do?
Well, you know, it really just fills in one of those really important patient requests. A lot of patients who come in wanting just a little bit of a tightening or a skin lift. Patients come in saying they just want to tweak like this. And other than traditional surgery, there hasn't really been a lot of products or devices that deliver that. So what this device really looks to do is deliver some heat into the skin through needles, and that in turn gives us a skin tightening effect. People will have this treatment for skin damage due to excess sun exposure. So people who've spent too long under tanning booths or in the sun, and you know, we've seen the effects of that. The skin goes leathery, it goes coarse, fine lines, deep lines. There's other patients who have scarring and also acne scarring. So these are the three main categories of patients we would see and treat with this machine.
So all of the viewers at home always are looking for safe treatments. How safe is this?
Well, I think this, in our clinic now, we've done well over 1,000 treatments and report a fantastic safety profile. One of the reasons for that is that the machine itself has been engineered so beautifully. The idea is that from the end of the handpiece, we get the needles coming out, and those needles are insulated. The idea is that we can deliver those needles at different depths. So we may choose to do that at 1 millimeter, 2 millimeters, 3 millimeters, and the energy is only coming out from the tip. The rest of the needle is insulated. So the idea is that we can deliver that energy precisely where we want to, and we can build up what we call a 3D effect. So we can stimulate the collagen at different depths in the skin to get a better overall rejuvenation.
So in terms of the amount of treatments that someone would need, obviously it varies per patient, but generally what number of treatments would someone?
A typical protocol, Stephen, would be anywhere between 3 to 4 treatments at 4 to 6 week intervals. But patients will often see the improvements after the very first treatment, so they can determine whether they want to have ongoing treatment or whether they feel that the result that they've achieved is good enough.
Great. Well, let's see it in action.
Sure. So with Charlotte, you know, you asked me earlier, you know, what her indication would be. The reality is we can think of this machine in two ways. It can either treat a pre-existing problem like sun damage or scarring, but we can also use it prophylactically to prevent and maintain as well. So by, you know, a lot of patients come in and say, I'm pretty happy with the way I look, but I wouldn't mind just, you know, keeping the tautness or, you know, definition in my jawline. And for patients like that, I think it's absolutely fantastic.
Great. All right, let's go.
What we're going to do is we're just going to treat along the jawline. So what you can see is I will just put the machine on, just pull the skin back. We've cleaned earlier and applied a little bit of anesthetic gel. I apply the device, and as I press the button, she gets the sort of needle array going through the skin and delivering the energy. And Stephen, you can probably tell just looking at Charlotte's eyes that she's really looking very comfortable. And so the idea is that the person who's doing the treatment would decide what areas need the most treatment. Obviously, this thicker skin, we're going to use a deeper needle depth. As we get to the more delicate areas around the eyes, we may reduce the needle depth. More heavily scarred or damaged areas may have multiple passes, but areas like the forehead, which is typically fairly well preserved, especially in Charlotte, we may just do one pass. And that would compromise one session, and then we might repeat that 2 or 3 times.
Great. I think it's an exciting new treatment. Yeah, I'm looking forward to having it myself. So thank you very, very much for coming in and explaining all that to us.
It's a pleasure, Stephen. Thank you.
Did you know that 5.4 million people in the UK are currently receiving treatment for asthma, and on average 3 people die from asthma every day? Some serious statistics there, which is why today's consultation room is about asthma. Now I'm with Ruman Sharma, our Dr. Fab expert, looking at remedies. Now let's start with an email from a viewer, Anne Shields from Nottingham. She says, I've developed asthma as a teenager. I've been on the same brand of inhalers ever since. Is there anything which would improve my chest and breathing, or any new products or alternatives?
The first thing to do is to check your inhaler technique. A lot of people find that they don't use the right inhaler technique. Because of that, that does not control your asthma. If you want an alternative product, I have one here, which is the Solitaire pipe.
This is it here, yeah.
This is it here, and the way it works is it works by salt therapy. And the idea is, as you inhale this, salt crystals go into the lungs, they cleanse your respiratory system, removing it of impurities, and that itself creates better lung function as well.
You know, how long would this last for someone? How many times would they need to replace it?
So the product will last 2 to 3 years, but you need to replace the crystals every 2 to 3 months.
I think asthma is such a big problem out there, and I think this is a great solution. I mean, I think so many people have asthma inhalers, but it's just nice to have an alternative. So
it is an alternative. It's an alternative to steroids. So if there's an overuse of steroids, or if there's a compliance issue, then this would be a natural solution to try.
Great, thank you. Whether you dream of long, defined lashes or fine and fluttery ones, our celebrity makeup artist, Scarlett, shows us how to pump up the volume for thicker, fuller lashes.
Before putting on mascara, I always recommend to curl the eyelashes first. It really opens up the eye. What you do is you look down and get the eyelash curler nice and close to the root of the lash. Give it a really good squeeze, pump it a couple of times, and then move to the end. Do the same thing. It really opens up the eyes like that. And then make sure that you don't have too much mascara on your wand. You want to do nice layering, but not too much. And on the top lashes, look down for me. You give it nice and close to the root and give it a really, really good wiggle. The top tip for me would be that if you get any printed onto your skin, wait for it to dry and just use a Q-tip.
Just being active, really.
Generally, just being active.
And eating right, I would say.
For me, riding my bike.
Radiance. Being sort of the best person that you can, really.
Not feeling out of breath playing football every Sunday morning.
Out the fresh air, keep fit, keep healthy.
That's all for part 1. Join us again after the break.
The Dr. Fab Show, in association with Artas Hair.